As of right now, there's an increasing elderly population in Hong Kong. By 2024, it's predicted that 21% of inhabitants will be aged 65 years or above. Once we grow old, our lives start to change. One big issue is that we begin to contract numerous diseases that come with old age, especially arthritis. Osteoarthritis, normally associated with old age, infects joint regions, especially among the lower body, as it's undergoing constant stress to help our body move. With no current cure but only procedures to maintain the negative effects, our future faces an increasingly difficult problem with no solution and only walking aids available. Secondary research emphasizes that osteoarthritis impacts the quality of life of 88% of arthritis patients, with 87% of patients experiencing pain and a third finding difficulty walking. Through product reviews, participatory observations, and interviews, the majority of people found existing products unaesthetically pleasing, as it reminded them of being old and to extreme extents causing negative psychological impacts. Until today, we present to you the A-Walker, an innovation which reduces joint pain around the lower body and increases the mobility of arthritis patients. We aim to design a walking aid for osteoarthritis patients, which meet customer need. The A-Walker is split into three main focus areas formed by robotic fabric technology, or we would like to call it artificial muscles. Is a form of technology that mimics muscle function, where it can be attached to fabrics and its varying flexibility can be utilized to absorb pressure. The artificial muscles are wrapped above, below, as well as along the sides of joint areas located at the hip, knee, ankle, as well as the backside of the lower body to keep the joints in place to prevent bone-on-bone rubbing. At the hip, knees, and heel, built-in pressure and motion sensors exist to control the artificial muscle. This product would realign the user's vertical plane, restore range of motion, while reducing stress on the lower body by redistributing impact forces away from joints through the works of the artificial muscles, ultimately making it easier to walk. As the knee bends, the forces exerted on the joints can reach 7 times body weight. When arthritis is present, this intense pressure causes pain due to lacking bone collagen. When the heel comes in contact with the ground, the lower knee and artificial muscle on the backside acts as a solid brace, providing mechanical support. As the foot is lifted off the ground, the artificial muscle relaxes, allowing range of motion and restoration of the user's natural walking gait. Given the user's accessing a staircase, the artificial muscle surrounding the ankle is programmed to increase in rigidity when the heel makes contact with the ground to further optimize the angle of temporary support structure. The A-Walker can be worn underneath normal clothing, as its materials are similar to yoga pants, such as nylon, polyester, spandex, and wool. The A-Walker provides walking assistance to users without being noticed by others, which could prevent thoughts of shame or other negative psychological thoughts brought by using a typical walking aid. The A-Walker can increase user mobility when facing obstacles, slopes, stairs, or even crowded space without the inconvenience of using a walking stick or rolling walker. According to our research, certain customers would complain about the bulkiness of traditional walking aids, claiming they would find it challenging to move through doorways, for instance. Compared to traditional walking aids, the A-Walker possesses intelligence which utilizes machine learning algorithms to adapt to different gait cycles and joint conditions of different users. Additionally, our product supports the entire lower body, whereas traditional braces are only made to focus on one particular joint area. This way, the A-Walker becomes a highly usable product, being able to be used by a variety of arthritis patients, especially those suffering from severe cases where arthritis has infected multiple regions among the lower body. Furthermore, while technically being a form of clothing, the A-Walker is planned to be sold in varying sizes to accommodate users of different demographics. It can also be washed, as the artificial muscle will be applied with a special waterproof coating. However, through professional advice, dry washing is highly recommended instead of traditional methods to ensure the artificial muscle is long-lasting. Lastly, adding on to the fact that our product can be worn underneath clothing, this emphasizes how compact the A-Walker is, making storage easier when not being used.